Okay, guys, I am back. Let me do a few things. Let's see. Let me go ahead and go live on Instagram. All right, while that's doing that, let me go in here and let me see something really quickly. Let me know you guys are back as you guys come back in. Let's see. Studio. Let me go back to YouTube. Oopsie. Let's see. Let me know as you guys come back in. I just need to do a few things since I lost connection the first time. Now I gotta go back in and set a few more things. Okay, glad to see y'all are back. Okay. Hey y'all. For those of you that's joining for the first time tonight, we were just live and I lost connection on my laptop. So I'm just trying to get everything situated again. I'm gonna share my screen again in just a moment. But if you are back, do me a favor and say I'm back. Let me know you're back from the other stream. Um, let me know if you are back from the other stream. So for anybody that may be just joining that wasn't on the last live, we were doing some study. We were doing some MA refresher. I'm so mad because I lost connection. Hopefully it doesn't happen again. I'm so mad. I hate when it happens, but hopefully it doesn't happen again. Let's see. Okay, Amy's back. Okay, some of you guys I've recognized from being back. I know Amy, you were there. All right, y'all. So I'm going to share my screen. I'm going to try to get through this quickly because I don't want the same thing to happen again. Let me see. Okay, Instagram. Bellamy's back. Okay, I'm glad you guys were able to get in. Gigi Storm, I'm glad you guys were able to get right back in. Gigi says, what do you think about the U.S. Care Institute? I'm thinking of taking an MA course there, but they do not offer externship or labs. The school is accredited and all classes are complete. So I've never heard of them, GG Star, but I will say you can go on. What I always recommend and what I do myself, I go on YouTube to see if anybody's talking about it. So look them up on YouTube, Google it. If you're in my medical assistant Facebook group, the medical assistant lounge, you can make a post and ask if anybody else knows of that school or may be enrolled in it and find out what they feel about it. As far as them not offering externship or labs, I don't like that because they're online and they don't offer any of that. If you're not already enrolled with them, I personally would not recommend a school that's completely online. First of all, I don't like schools that are only online. Okay. At least if they're online, they need to be able to at least be providing some labs, right? It needs to be hybrid, or they need to at least, as soon as you are going through the coursework, they need to at least have an externship for you to go straight to as soon as you are done to get your hands on training. So I don't recommend, I'm not going to say that school in particular because I've never heard of it, but any school that's online and they don't offer externship or labs, I don't recommend them at all. Hey, Anna. Oh, Anna, you on Instagram too. Okay. Thank you, Anna. Let me check back in on YouTube and Facebook. I see I lost most of the people. Everybody not even back. That's why I hate when it cuts off because you lose everybody. Oh, okay. I got you, Makisha. I'll go back in a little bit. All right, so I'm going to share my screen again. Let me see, where was I? Let me just share this one more time for anybody that's joining this live that wasn't on the last one. I just wanted to let you guys know that at my MA refresher course, that's normally $27, is $9.99 for right now until Monday. Okay, and this is what I go over in the course. Everything you need to know to pass certification, medical terminology and anatomy. I have quizzes on here, practice tests, and all of that. Okay. And then you'll see the Black Friday sale. You'll see that it expires in 2 days, 5 hours, and 30 minutes. But it's $9.99 for 45 days of access. Okay. So that's what we've been doing today on the last live. and I started going over some information that's going to be on the test. So let me get back to that. I'm going to share my screen again, and then we're going to get back to it. So I just hope I don't have any issues this time. And let me make sure my microphone, okay, my microphone is hooked up. Okay. Let me share my screen again. And do me a favor, guys, for anybody, if my videos are helpful to you, do me a favor and like the video for me. It helps it to get out to more people. Also, if you're not subscribed, you can go ahead and do so. Most of the people that watch my channel is not subscribed. So if you're not subscribed already, you can go ahead and do so. If you want to hear more from me, if you don't, then that's fine. But if you do want to hear more, go ahead and subscribe for me. Oh, let me look at these comments one more time really quickly before I get back into it. GG Star, Anna says, when looking it up, look for the medical assistant line. Thank you, Ms. K. It makes sense to me. Yeah, I do. And for anybody else that's considering a school online, if that school, first of all, I don't like schools that are online only. I think I know as a medical assistant, you need your hands on, but I will give a school a pass if they're online, but they give you an externship to do your skills. Or some schools, GG, you might want to look for something that is hybrid, right? That you can go in and do your clinical skills, or at least they will send you materials to practice along with them virtually. Okay. And they have an externship. But if they have none of that and they're only online, that's an even bigger no-no. Okay. Wait, you do this live, Joshua? Yes, sometimes I do. Like now I did it a few, like October, I went live every single day. But yeah, what happens after the 45 days are up? So with this one, if you want, you will have to get it again. So if you need more than 45 days, you may want to get the regular study guide, which is $27, and that's 3 months access, 90 days. So if you need more than 45 days, because I have a 90-day option and I have a 6-month option. So you got 3 months and you got 6 months. But for Black Friday, I wanted to do, first I was going to do 30 days. I was like, no, let me do 45 days, an extra 15 days, just for people that may be about to take their test soon. They just wanted just something quick. So that's why I just did the 45 days versus the 60 and 90 days that I already have. So yeah, after 45 days, your enrollment, your access will expire, and you would need to get it again. Or like I said, if you know for sure you need more than 45 days, you can just get the 3-month access, and it's $27. Abigail says, I'm in Stepful now. Okay, Sarai says, so Gigi, I'm going to highlight this on the screen because Gigi, you're not able to see the comments on YouTube and stuff, but I'm putting it on the screen. So a couple of people said they went to Stepful, and they said they do provide externship. Okay, so I do hear a lot of people. There's quite a few people in my medical assistant group that went to Stepful, so you may want to maybe look into them. I don't have an opinion one way or the other because I'm not too exactly sure with them, but you can always check them out. Let me see. Passed my NHA test. Congratulations. Joshua says, should I still? So Joshua, let me know let me scroll back up, Joshua, and see if I missed something else from you. Because you said, should I still buy it? So it's up to you, Joshua. It depends on if you feel like you need it. So with the refresher, it is like you're listening to lessons. Like I teach lessons on there, and then you get quizzes. So it depends on what you feel like you need, Joshua. So I don't necessarily want to say yes or no, because if you're preparing for certification, I'm going over all of that. So like, let me click on something for an example. So like medical terminology, medical law and ethics. Oh, dang, I'm not even signed in. Let me stop sharing and sign in really quickly so I can show you what it looks like. I didn't realize I wasn't signed in. Oh, you know what? Duh, I know what I need to do. Actually, let me go back. I don't need to sign in. I was on the student access. I need to go back and be on admin access. I'm just going to show this real quick. We're going to get back to the study. I just want to show this really quickly for Oh, why is it not giving me the option to see is this is really weird. Why is it not letting me giving me the option to see it as a student? That's weird. Let me see. Preview. Is it gonna let me see it now? Let's see. Okay, I don't know why it's not giving me this option but I do want to show you, especially for those of you that don't know if you want it or if you need it. This is really weird. Why it's not letting me sign in. Let's see. Let me see how we doing over here on Instagram. Sorry, y'all. Yes, it's a Facebook group. It's called the Medical Assistant Lounge. Sorry, y'all. I just want to be able to sign in so I can actually show y'all. Clinical here. Preview curriculum. If this don't show me the curriculum, I don't know what else to do. I don't know why it's not letting me preview it and show you. Okay, here we go. Sorry, y'all. Now I got it. Normally, it doesn't give me this many issues to preview it. All right. So Joshua, if you're still here, oh, sorry, I clicked on the wrong thing. If you are still here, Joshua, and anybody else that's wondering what exactly is in, is this it? Let's see. Oh my goodness. Is this it over here? Oh, I keep sharing the wrong screen. So this is how it looks. So basically, this is the course here. I was trying to click on the medical law and ethics. So basically, this is how it looks. Like there's a video lesson, and then you get a quiz. So like according to HIPAA, who owns a medical record? That will be the provider, right? So then you go to the next question. Here, a person collapsed in front of you is now not responsible, which of the following allows. So implied contract, implied consent. So literally exactly the same type of questions you will see on the test is what I have on here. So it just has different lessons in here. There's a quiz after each lesson. And then at the end, there are 3 practice test questions that have 50 questions in it. So that's that. So I just wanted to show you guys that. Okay. So let me stop sharing this and let me come back to this because I know y'all waiting on this. But I just wanted to make sure I showed that for anybody who was wondering, like Joshua was, like, do I need it? Should I get it? Okay. Gigi says she's going to join. Okay, cool. All right, y'all. Y'all ready to get back into this? Because we got cut off. And I'm sorry, y'all. I know some of you guys, I know Simone says she's taking her test Wednesday. Somebody's taking theirs next Saturday. I know y'all were enjoying this this refresher. So I want to kind of get back into this. And then I'll get back to the comments. All right. So where we left off was, the coaching. This is where we left off. So I was saying that I know for a fact that this coaching questions are definitely on the CCMA. They're probably on the other certifications as well, but I know for sure these are on the CCMA. So like disease prevention coaching, an example of that is educating the patient on how to prevent disease. For an example, tobacco use. Disease prevention coaching, example of that is hand washing. Health maintenance coaching, an example of that is just making sure patients are getting their routine screenings. So you may see a question that says like you have to coach a patient on scheduling their annual or their not annual, because you don't need an annual, but like they're scheduling like their bone density scan or their colonoscopy or mammogram or whatever. What is that an example of? That's an example of health maintenance coaching, like they're getting their routine screenings. Diagnostic preparation, preparing them for a diagnostic test. Okay, so that means if they're fasting or if they have to take some type of medication first or drink some type of liquid, like if they're having colonoscopy. And then coaching to support compliance, that is an example of that is like the patient is, checking their glucose at home or insulin administration. This means that they are compliant with their treatment. And let me actually put the link to the refresher course in the chat. So for those of you that want it, let me go ahead and put it in the chat. See, this is why I was so mad that I got cut off the first time, because I had all of this done. All of this was done. I had everything in the chat that needed to be in the chat. All of that. And then you get cut off and you got to start everything all over. So let me put that in the chat for anybody who need it. Study guide link. And I will pin it. All right. So the next thing, let me paste it on Instagram as well. Sunshin on Instagram says, I really need your help. What do you really need my help with? Let me know. All right, so let's go down here. So communication cycle. So that's another thing they may ask about. The communication cycle involves the sender creating a message, right? So that's like you and I talking. I'm the sender. I create the message. What I'm saying to you is the message, right? You're the receiver. You're going to decode the message or understand and figure out what I'm saying, right? And then you're going to create feedback, which is your response. When you give me feedback, I'm going to decode that feedback. Okay, so that's the communication cycle. Make sure you guys know your positioning as well. Okay, that positioning, I think I kind of showed you guys a picture of it for an example, but all you have to do for your positions, just make sure you can simply literally go to Google and look up physical exam positions. Make sure you know all of those. Okay. What else? This is some other things, and all of this, like I mentioned, is things that I cover in the study guide. But what I'm doing here is just for those of you that's about to take your test that don't have my study guide, I just kind of want to give you just a quick overview of just some things you need to make sure you know, like the Snellen chart. That's a vision acuity test. Okay. The Ishihara is the color test, looking for color blindness. Okay. The hearing, you got two different types of hearing tests. You got the Weber, when you place the tuning fork on a patient's forehead and have them let you know if they hear louder in one ear and the other. So they may ask you about this, and you got to make sure you know which one is Weber and which one is Rene. With the Rene test, you place it behind the ear and let them know when they no longer hear the sound. Okay. Then you got some pulmonary tests, which includes PFT, peak flow, or even spirometry. Okay. Now clear wave. What does clear wave mean? Those are low complexity tests, meaning they can be done at home in the doctor's office. At home, they can be done in the doctor's office, in the pharmacy, and nursing homes. These are some example of those tests. Okay. So you may see a question that says, well, you may have to rule out something that's not a clear wave test. Okay. Your needle sizes and angles. Yeah, that is important. So let me just kind of highlight this really quickly right here. So needle sizes, your your angles, 90 degrees is intramuscular. Sub Q is 45 degrees. Intradermal is 15 degrees. Okay. Make sure you guys know that. And also your needle sizes. Okay. What's another thing I want to mention? Oh, your high blood pressure, your normal versus elevated, stage 1 and stage 2. And this right here, if you guys want to just kind of take a picture of that right there, that's fine. Or a screenshot of that right there. That is perfectly fine. And let me go to the comments, make sure I didn't, because last time I wasn't sharing my screen and I missed it because I wasn't looking at the comments. Let me make sure y'all can see that. So what study guide would I need to get since I have started yet? Since I have What test are you taking since you have not started yet? What test are you taking? I just put the link in the chat. I'll put it in the chat again. Oh, I can't put it in the chat again because it's going to post to Facebook too. Facebook, they flag you if you post too many comments. So what I'm gonna do, Makisha and Talita, that's asking. Let me just post it. Let me just pin it to the top so you can see it. So I just pinned it to the top of the live chat so that way you can click on it. But that's the link. So I know medical assistant, Makisha, but which test? CCMA, RMA, CMA? Are you taking? If you're taking an administrative only test, then you get the administrative study guide. If you're taking like the CCMA, the RMA, or the CMA, you need to get the clinical one, the one that's only $9 until Monday. Okay. Is all of this covered in a refresher course? Yes. Speak knowledge, absolutely. All of this and more. I go over a lot in the course. CMAA on. Okay. Good luck. Good luck with that, Talita. Good luck with that. Okay. I'm gonna come back to some of these questions. Let me kind of get through this and then I'll come back to the questions. All right. And then what's this? Your pulse rates, your respiration rate. Oh, one thing too I want to mention about orthostatic hypotension. So one of the things they may ask you, first of all, orthostatic hypotension happens when a person's blood pressure drops drastically when they sit up or stand up. So one of the questions they may ask about is how do you perform those? So basically, when a patient comes into the room, first of all, you want to wait about 5 minutes before you check their vital signs anyway. You usually want to get their do the intake and all of that first before you start checking their blood pressure. Don't just bring them back and, sit them down and automatically check their blood pressure. They've been walking. You had to bring them back. They probably just got there. Wait a few minutes. So you always want to do all of that first and then do the vitals. So that's a question they'll ask you. Another thing too, they'll ask you about as far as orthostatic hypotension, they'll say, how do you do it? So you want to, first of all, you're checking the patient's vital signs while they're lying down and then sitting up and then standing up. And you want to wait a minute in between each reading. Okay, a minute between each reading. Now that you know how to check orthostatic hypotension, if they throw something in there and they say wait 5 minutes in between each one, you can rule that answer out. If they say bring the patient back and automatically check their vitals soon as they get in and then standing up, sit like, that's wrong. Okay. You want to wait about 5 minutes with any patient. When you're doing orthostatic vitals, meaning you're checking to see if the person has orthostatic hypertension, you want to check it lying down and then sitting up and then standing up, and with a minute in between each one. All right, you guys can take this. Another thing you guys can take a screenshot of if you want. Make sure I make that black. Your pulse respiration and pulse ox. Yeah, I'm gonna end this soon. I'm getting tired of talking. I've been talking all day, literally. I'm really getting, y'all don't know. It's sometimes talking is exhausting. Oh, your blood work ranges. Listen, I do have a YouTube video on the blood work ranges. So just if you go to my channel and look it up, you'll find it. This is some of them right here. There's not all of them. It's more to it than this. In my study guide, I do go over all the blood work ranges you need to know for the test, but this is just a few of them. Okay. So I do want to make sure you guys know that. Okay. So this is another one you can kind of screenshot. Your order of draw. This is just the acronym my students came up with. Young boys really get great looking girls. Okay. Your young is for your yellow blood culture. Light blue is for B. The B is for light blue. Boys really red. Gets is for gold, same as marble. Let me make sure you guys know that that's the SST, the serum separator tube. Okay. Green, lavender, gray. One other thing you guys need to know with this order of draw are the additives that are in each tube. Okay. You do know them. I'm not going to go over that now. It's in my study guide, but I'm not going to, it's a lot because you got to know the additives that is in each tube and also the department that it goes to when it gets to the lab. Okay. What's another one? I want to make sure I stop on. Oh, your urinalysis ranges. Okay. That's another one. I do go over these in the study guide. your infection cycle, okay? You got your reservoir host, your port of exit, mode of transmission or vehicle of transmission, port of entry, and then a susceptible host, okay? This is another one that gets people caught up. The differences between the sanitization, disinfection, and sterilization. Sanitization is the lowest level, okay? It's reducing the number of microorganisms to a safe level, okay? With disinfection, is destroying pathogens or rendering them inactive, okay? Does not kill the spores. I put does not spores. It should say kill spores. So let me fix that. Oh. So make sure you guys know these differences. And then, of course, sterilization is the complete destruction of all microorganisms, okay? Autoclave must be 250 degrees Fahrenheit, okay? What's another? So what I'm gonna do, y'all, I'm gonna go live again tomorrow and do some more of this because I do want to make sure I go live again while I still have this $9.99 sale going on. So I'm gonna go live again and I'll go over some more of this because it's kind of a lot. Well, it's like 2 pages, so I can show you guys that. Make sure you know your appointment types, your letter styles, and then more administrative stuff, okay? Let me see if you guys have any questions. Let me check Instagram really quickly. Will you be doing a CMA? I have a CMA. I have so many CMAA. Cooley, are you following me on you still here, Cooley? I'm sorry, I'm just saying your message. Are you following me on YouTube? If so, if not, you can go to Medical Assistant with Miss K and at YouTube, and I have a playlist. It's called CMAA practice or exam practice, something like that. And I do all of the CMAA reviews. I also have the CMAA study guide as well. So if you need that, I'll put that in the chat as well. For the administrative part, for anybody that's only taking a CMAA, you only need the administrative study guide. If you're taking any of the clinical certifications like CCMA, RMA, CMA, AMCA, you need the clinical one because that goes over all of the clinical stuff, but then it also has the admin in it as well. Okay, so let me just admin only. Okay, so I'll put that in there too for you. All right, and let me go back and see these questions. I'm sorry, y'all. I just wanted to kind of get through those because, like I said, we were live before we got cut off. Like, as far as tips for no experience, I got those videos on my channel. I won't get into those tonight, but I do have that on my channel. And I'll approve you, Makisha. Hey, Deidre. Let's see. I'm starting school, Jane. Oh, you know what, Makisha? Is that you I was talking to on Facebook earlier? Are you still here, Makisha? I think me and you were chatting on Facebook in the comments earlier, and you were asking about if you should get it as a head start. Okay, Joshua says I'm currently doing a hybrid. Okay, yeah, I definitely recommend it. Then only reason why I say that, Joshua, is because all of the students that I have, and when I say students that I have, I mean other students that are not my actual students. I mean students that I meet like this through Facebook, my page or whatever, Facebook, YouTube. Everybody that's in not everybody, but for the majority, those that's in a hybrid program are struggling. So I definitely would recommend getting it because I'm going over everything in depth. Like I'm actually teaching you in it. I just got done taking my test. Oh, Maya, let me know when you get your scores back. Speak Knowledge is I just purchased a refresher course. I also have NHA, but I love how Miss K teaches. Thank you, Speak Knowledge. I'm glad to hear that. I'm scheduled to take. Okay, January. Oh, that's perfect then. Okay, you got 45 days, so this is perfect. Speak Knowledge. Postponing my test for a year, but now I'm ready to get it done. It is time. Speak Knowledge. It is time. Somebody says Carrington. I don't know if Gigi is still watching on YouTube. I'm sorry, on Instagram, but somebody just suggested, what is that, Carrington College? So I don't know if you're still here. Okay, Cooley, you said yes, man. Okay, just making sure. Oh, yeah. You're not yet. No. Okay, so you already familiar with them. Okay, perfect. Okay. All right, let's see what else you guys are asking over here. So I'll take my final, then go to clinicals. You can just order your 90-day. Um, hmm. Should I do I don't think so. I don't have a 60 day. I have a 90 day and a 6 months. And then the one that's on sale until Monday is 45 days. And you said you take your final exam January 7th. You're not finished until January. I would say wait, Jessica. I would say wait. Finish your schooling, finish your final exam and all of that. I would say wait. Just wait till then, till January to get it. And then you can just do the lowest time is 3 months though. I'm only doing a 45 day just as a Black Friday sale, just to give people the option to just get it for a short period of time for cheap. But I would say wait, because I don't want you to get overwhelmed either. Sometimes when you're trying to study for certification and your final and all of that, it could be a lot. So I would say, and then you got to do your clinical. So I would say, yeah, I would say wait until you're, at the end, and then that way you can be studying while you're on your externship and all of that. So I would say, yeah, January. Hey, Angela. Hey, Bianca. Bianca says I'm back. Okay. All right. So I think some of these, let's see. Some of these I answered already. I'm taking a CCMA with study guide. Should I purchase that's going to be the Pocahontas? That is the clinical study guide. So if you go to marefreshercourse.com, you'll see a $9.99 Black Friday sale. That's the one you need because that's the clinical certification exam. So if anybody is wondering which one you need, let me just make it clear for you guys. For anybody that's wondering, if you're taking the CMAA, meaning the admin only, all you need is the administrative study guide. Any other certification like CCMA, RMA, CMA, AMCA, NCCT, any of those, you need the clinical study guide because it goes over the clinical portion and it also goes over the administrative portion as well. Okay. You guys are welcome. Y'all are so welcome. You're welcome, Bianca. No problem. You guys are welcome. Fully online. Okay, Pocahontas in my class is fully online. Nervous about the phlebotomy part. Yeah. Pocahontas, if you're still here, did they at least send you any materials to practice with, or are you getting an externship? Like, let me know how that's going. Hey, Soraya, I see you back. How is that going for you? Like, what are they providing for you? Because hopefully they're giving you something since you're online, fully online. She said, yes, I'm enrolling for school in January. Want to learn everything. So yeah, and that's perfectly fine. I say if you want to do it now, and keep, especially if you want to get a head start before you start, that's fine. I don't want you to get overwhelmed though, but if you just kind of want to, I do want to point out, guys, that the reason why I'll call my study guide an MA refresher course because it's literally a refresher course. Like I'm teaching everything you learned in school. I'm just teaching it in a quicker way. So Makisha, if you want to go in and like literally take it as a course, you can, because it's literally lessons. Just like I'm teaching you guys here, I do that there, but it's just in different modules, and then you get a quiz after it. Angela, the link for the study guide is pinned at the top. So if you look at the chat, it's right there at the top of the chat. It says study guide link. The reason why I can't post it again is because when I comment here, it's going to go to Facebook and YouTube, and Facebook continues to remove my comments because every time somebody asks for the link, I post it, I give it to them. And Facebook now, they look at it as spam when you're constantly posting the same link. So I can't even post it here because it's going to go to Facebook too. That's why I post it here, and then I pin it so that way you can have it. But it's pinned at the top. Facebook, y'all, when I tell y'all, let me not say too much before they cut me off right now. Okay, thank you so much. 3 months is okay. Yes, when you go into X-ray. Yeah, that's perfect, Jessica. Oh, you getting a kit in the mail? Okay, good, Pocahontas. That's good. You getting a kit in the mail, so that's good. So yeah, so you'll get that practice, and then you said you think about getting in person. Yeah, I mean, if you don't mind spending a little extra to get to take a phlebotomy class, I think that's a good idea. Because when you online only, you on your own. So really feel comfortable with it. Like, I get it. I get it. Let me go back to Instagram really quickly, see if I missed everything over here. Let me see if anybody. Okay, nope, nothing. Let me know if you guys have any other questions. I'm going to go live again tomorrow. I'm not sure what time yet, but I'm going to do this again tomorrow just to kind of remind people that I have this sale going on, because I have people who want my study guide, but they may not necessarily be able to get it. So I just wanted to make it $10 for a few days. All right, guys, let's see. Did I miss anything? Joshua, are you still here? Did I answer your question? Let me know if you're still here and if I answered your question. Let me know. And let me stop sharing this, as a matter of fact. Let me come back on the screen. Let me know, guys. What's the link? Oh, somebody just asked again. Oh, is this the same? It's probably the same comment that I saw before. All right, guys. So if you don't have any other questions, do me a favor and like the video for me if it was helpful. If you aren't already subscribed, you can go ahead and do that. For those of you watching on Instagram, if you're not already following me on YouTube, you can do that as Medical Assistant at Medical Assistant with Miss K. And I'll be back to posting videos again soon, guys, and going live. I know I haven't been live or doing any videos in a while, but I have a few video ideas that I'm going to be doing hopefully this upcoming week. Yeah, it's for the CCMA. It's for all of the certifications, Juan. CCMA, RMA, CMA, all of them. They all ask the same kind of questions. Oh, excuse me. They all ask all the same questions. So if you guys are ever wondering, they all ask the same questions. They all do, really. Even if you look at the video I did a video on the showing the different test plans for each of those tests, and they were literally all the same. They all had the same information. All right, guys, I'm gonna get ready to go. I love you guys. I'm going to go live again tomorrow. Hopefully this was helpful. I'm probably going to end up trimming this video because I think the front of this video, the beginning, I kind of was just kind of trying to figure things out and get everything posted again because I got cut off from the other video. If you didn't see the first one, you guys can check that one out too. If you join here and you didn't see the part 1, you can check that out because I did go over some study material on that one as well. Let's say says, so your video passed, CCMA from DC. Oh, let's say, congratulations. I'm from DC too. What part of DC? Does a CMAA program NHA? No, but job, is that normal? Yeah. So CMAA programs, they don't tend to have externships. Yeah, they don't tend to have that. The program that I teach for, we have a CMAA program and they're trying to get them externships. And I think they may get 1 or 2 here and there, but yeah, that's not uncommon, Amy, for a CMAA program to not have externship. The medical assistants have externship because they have to learn their clinical skills. So that is why they get an externship. They learn them in class, but then they got to go in the office and do them hands-on. Get their real hands-on experience. All right, y'all, I'm going to go ahead and get ready to let y'all go. I'm going to go live on TikTok in a few minutes. I'm about to go live on TikTok. I don't even do TikTok, but I'm going to go live on TikTok in a few minutes. Just for a few minutes and talk about the same thing I'm talking about here. What is my TikTok? I don't Miss K all over the place. Is it MIZZK or what's my TikTok name? Ms. K, MIZZK _ all over the place because I'm all over the place. So I'm getting ready to go live on TikTok. That's MIZZK. If anybody want to go over there, MIZZK _ all over the place. I love y'all. Y'all have a good night.